Hey everybody, how are you guys? Dr. Stephanie Stroud here with Cornerstone's Pet Tip of the Week. Tonight we are talking about heart murmurs. So how many of you guys have been in an exam room with your cat or your dog and all of a sudden your vet says, Fluffy or Bingo or Bella has a heart murmur. And you think to yourself, okay, what's that mean? Is it serious? What do you need to do? So I'm going to talk about all of those questions today, okay? So what is a heart murmur? So normally when we as veterinarians are listening to the heart, we hear a thud-dump, 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 just like you do if you're to listen to your own heart, okay? So really nice, crisp sounds, thud-dump, thud-dump, thud-dump. When we hear a murmur, and we're talking today about dogs or cats that are older than a year, okay? We're not talking about physiologic or congenital murmurs, but we're talking about murmurs that have developed. So in those pets that are a year or older, instead of a nice crisp thud-dump, 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 we're hearing a thush-dump, thush-dump. So it's not as crisp, it's not as clear, and you hear this sh-sh-sh sound in between the thud-dump, okay? And that is what we call a heart murmur. Murmurs are basically just a sound that we hear when blood is not going the way it's supposed to. So in the heart, there are different valves that are meant to keep the blood going in one direction so that you can go to the lungs, they can exchange carbon dioxide for oxygen, and then they go out of the lungs to the rest of their body, whether that be to the muscles, the organs, the brain, okay? The heart is important because it gets blood to where it needs to be, okay? And so that is where we hear the dump. That's keeping blood flow going the right way. When we start hearing a murmur or a sh-sh, the sh-dump, that means that the blood is actually not getting exactly where it needs to be. Instead, it's actually going backwards some through the valves. And so the valves or the size of the heart or something has changed where now instead of the blood going very smoothly through the valves, it's actually getting mixed and it kind of makes a whirlpool within the heart. And that's the sh sound that we're hearing. That's called a heart murmur. Okay, so with animals or pets that are over a year of age, whenever there is a murmur, it does not matter how quiet it is or how loud it is, okay? Your veterinarian may say, oh, we hear a murmur now, it's not very loud, or we hear a murmur, this is really loud, okay? It does not matter whether it's soft or whether it's loud. If your pet has a heart murmur, there is underlying cardiac disease, there is underlying heart disease. And so it does not matter what stage or what grade that we're hearing as veterinarians, if your pet has a heart murmur, they should always have a cardiac workup. Generally, that means we take x-rays of the chest so we can look at the size of the heart, so we can look at the lungs to see do we have enlarged vessels that are going away from the heart, such as in congestive heart failure, or are the lungs clear and we just have a mild enlargement of the heart. We also usually recommend doing an EKG, so we're looking at the electrical activity of the heart, seeing is it actually beating the way it's supposed to? Is the electricity that's going through the heart telling it to pump, is it actually targeted specifically where it needs to be to help it function properly and get blood flow to the rest of the body, which is very important. And also we'll usually take a look at the electrolytes as well, because as the heart changes, as it becomes diseased, you can get changes in the electrolytes in the body. So we want to look at all those as a whole, and that is what we call a cardiac workup. If indicated, sometimes we really need to do an ultrasound of the heart to look at not only see that the heart is enlarged on chest x-rays, but when we look at an ultrasound of the heart, we're able to identify and look inside the heart. So x-rays always kind of look at the shape, so it's like standing outside of a house. You see the shape of the house. What an ultrasound does is it goes and looks at the rooms, the interior design, and so it looks at the wall thickness of the different chambers of the heart. It looks at the valves and says, okay, where are we seeing changes in the heart, so we can identify what part is diseased and where is that murmur coming from. Now your veterinarian will be able to identify a little bit where the murmur is coming from just based on the different locations of where they're hearing the murmur in the heart, because there's different chambers that we listen to when we listen to the heart, so they'll be able to get an idea. But an echocardiogram, also known as an ultrasound of the heart, is going to be able to identify just how much the heart is not working. And so putting all this together allows us to identify what medications your pet needs to be on, okay? Early detection of murmurs and early chest workups of the heart allow us to place them on some medications sometimes that allow us to slow down the progression of the disease. Now, if we're in congestive heart failure, where you've got buildup of fluids in the lungs, buildup of fluid in the belly or in the liver, because the heart's not working the way it's supposed to, then oftentimes your pet will need to be on a lot of different medications to get that under control. But if it's just very early in the disease, very stage 1 or stage A, then oftentimes we can put them on a medicine that's going to try to help slow that down, and we can monitor and add in other medications as we need to do, which is actually the preferred method because we can actually increase the longevity of their life. So that is kind of a brief synopsis on heart disease and heart murmurs. So let's talk about real quickly though, what are signs of potential heart problems? So that you need to monitor for at home, especially after your veterinarian has told you that your pet has a heart murmur. So the number one thing you guys can do with your pets at home is to keep track of what we call the resting respiratory rate. All that means is that you are counting the number of breaths they take per minute while they're asleep, so while they're relaxed. And so I recommend letting your pet go to sleep and then setting a timer for a minute and counting the number of breaths they take. And all you have to do is watch their chest kind of go out and go in, and that counts as 1. Just like with us, that's 1 breath. So same for our pets, okay? So generally, pets should be less than about 30 to 40 breaths per minute when they are asleep. Okay, if we're getting above 40 breaths per minute while we're asleep or while we're resting, then that's very concerning. That means you need to have your pet checked out by your veterinarian ASAP. Very, very concerning. Other signs that you may see that could be early heart disease starting is your pet is coughing at night, or it's coughing early in the morning. During the day it may be fine, but starting to see coughing early at night or during the night or early in the morning. Other things is maybe you're seeing coughing after your pet exercises. Other things is maybe that your pet isn't as active as they used to be, so they have what we call exercise intolerance, where they're just not really able to run and play as much as they used to. Okay. The other thing you need to it's good for you to keep an eye on, and I would recommend monitoring, is their gum or tongue color. So if you look at your pet's gum or tongue color right now, it should be pink, or it should be, they should always be pink. That's it. They should be pink. Sometimes if you have a darkly pigmented dog or cat, their gums actually may be black, and that can be normal for your dog. So look at their tongue. If you look at both of those, it should be like a nice Pepto-Bismol pink. If it's starting to look kind of muddy colored or purple or blue, that is an emergency, and you need to get your pet to your veterinarian just ASAP. Very, very concerning, and that is an emergency. Again, coughing any time of the day, but especially if your pet has not been one that coughs and all of a sudden we're coughing early in the morning or at night, then that may be a sign that they're starting to get some disease in their heart and that they need to be looked at by your veterinarian. So that kind of sums up. It's a big thing to talk about with heart disease, but those are some of the things you can monitor for. Like I said, if your veterinarian hears a murmur, regardless of whether it's loud or whether it's soft, the best thing and the gold standard in veterinary medicine right now is for them to have a full workup, even if it's just a very quiet murmur, because we want to identify the level and the stage of disease early on so that we can keep your pets with you for as long as possible, because that's my goal and that's our goals here at Cornerstone Animal Hospital. Pets are family for us, and we want, we realize that your pets are very, very important to you, and we want to keep them in the family for as long as possible. So thank you so much for watching. I always enjoy you guys getting on. I am just honored that you guys would let me chat with you. So just want to say hi to everyone that's watched. If this is your first time watching and you want to catch up on our other videos that we've made, you can find them right here on our Facebook page. You can just go to the video section and we'll have all the videos. You can also find them on YouTube under Cornerstone Animal Hospital, or you can go to our website, cornerstonevet.info, go to the About section, go to Videos, and then click on Pet Tips, and that will have all of them there. There's lots of different and good information on our website. We have some papers talking about different things, so professional papers, and so that is just a good resource for you to do and to look at. There's a blog, so lots of different things for you guys to get good information so you know how to take care of your babies. All right, we'll see you guys later. See you next week.